Dr. Mike Headlee at Explore Chiropractic, where we empower people to get healthy and stay healthy so you can live your best life possible. And the title of this one is 6 Things to Know About Spinal Fusions and Prescription Medications. I posted something last week on Facebook about Tiger Woods and his failed spinal fusion surgery. And sometimes spinal fusions and spinal surgery is necessary, but before you just rush into it, you think it's going to be a quick fix. It might be a quick fix, but you got to think about it long term. So here are 6 things to consider before you rush out and go talk to a surgeon and before you rush out and have the procedure done. Here's what the article says. Spinal fusions are increasingly common. So it's just like an everyday procedure. Number 2, many people become dependent on pain relievers after back surgery. So they're going into surgery to get relief, but they come out of it, a lot of people, according to the article, reliant on a lot of medications. Number 3, the surgery is often done when it's not needed. Now, the surgery is often done when it's not needed. Dang, that's serious, to be cutting open the flesh of your back and the ligaments and muscles and tendons and getting really close to the spinal cord and nerve when it's not needed. Number 4, as an alternative to surgery, opioids aren't much better. And I posted another article about opioids and the medications and how addictive they are. It's a really, really serious epidemic going on right now with those type of medications. Be cautious before you just start popping those pills. Number 5, doctors get paid big bucks to do the surgeries. Major bucks, they aren't necessary, often needing medication afterwards, so it's not a quick fix, never need any other type of treatment afterwards. Number 6, but spinal fusion may not help people in the long run. I mean, I can't make this stuff up. And people wonder why Tiger Woods can't get back on the tour. He's had multiple surgeries, fused his lower back. So I want to explain a little bit of what a spinal fusion is like. If this represents your spinal cord, ideally we want to be in good alignment. And ideally we want to have all of individual segments moving properly. So when I bend this, most of these representing the spine move properly, except for the red ones. They're stuck, they're inflamed, they aren't working right. So what do chiropractors do? We locate, analyze, and correct something called a subluxation. It's where there's something interfering with the nervous system. And so what we do is we do a specific adjustment to put motion in there to get this nervous system functioning right, so then it puts ideal function back into your spine, so you get the motion. And so with the fusion, vertebrae are fused. If we fuse these segments here, they aren't moving. They'll never move unless you get a jackhammer. So look at the segments above and below, how much that has to move. And so then that area is going to have extra stress and strain and deterioration, and that's where the interference is going to come at next. And then this area, that doesn't mean that's going to be pain-free and inflammation-free and nervous system interference-free. So you want alignment, you want movement, but you definitely don't want to just rush into fusing your segments of the spine, because then you'll have zero function at those levels, and you're going to have to get movement in your spine somewhere, and it's going to be above and below the area. And the article says you're going to be hooked on a lot of medications, and it's just not a quick fix, in my opinion. Talk to the surgeons, have an honest evaluation, and say, is this my only resort to have surgery? And if it is, good luck with it, and I hope the best for you. But just don't rush in without trying chiropractic and other natural means and just go get bolts drilled into your spine. I hope this helps. If you have any questions about spinal fusion surgeries and what you can do afterwards or how to avoid it, please comment down below and I'd be happy to help. This is Dr. Mike Headlee at Explore Chiropractic, where we empower people to get healthy and stay healthy so you can live your best life possible. Have a great night.